All the public health professionals at one point or another have to make a proposal. So let's discuss in brief what proposal is all about. I'm Dr. Pranav, public health scientist and academic. And if I say a report is a document anchored in past, a proposal is document that is anchored in future. I always say to my students, public health is one thing where mostly the beneficiaries are not the people who are paying you. Like in my clinic, my patients are paying me and they are also the beneficiaries. So if the patients get better, I don't have to show to anyone else. The money that was invested and paid to me brought the result. If someone came to me with very high blood pressure and I treated him, I don't have to tell anyone else that if you pay me my fees and get my advice, you will be getting treated of hypertension. But imagine the condition in public health. So you are working for vitamin D deficiency and challenges of bone health in school-going children in an urban slum. Now the children, they are not paying, their parents, they are not paying. You got money to conduct this program from someone who wants the health of the urban slum children. It may be an NGO, it may be government agency, it may be a development agency. Now, before starting the project, they want to understand what kind of results you will be able to deliver. So for that, the first thing is you need to have a clear record of your achievements, a clear record of what in past you have been able to do. Like if I have been working for 10 years in development of children and I have been implementing child health programs, I will pass at least one test that I have got the capability. Now the second thing is what kind of result and how I am going to achieve the result. And here the most critical 2 points are: first is the requirements which are needed and the kind of money that is required to meet those requirements. So to implement any program, you require first manpower. To implement child health program, I need a lot of child health educators, psychologists, pediatricians, doctors, public health professionals for implementation. So I require a team and that team will require salaries. So for the duration of my product, what kind of monetary outlet will be required for hiring the people and how many number of people will be required? That's my first requirement. The second one is the infrastructure and the items, the things, equipments. So all the child health measurement equipments, and then the supplies to make interventions like vitamin D, calcium, food supplements. So what will be monetary requirements for all these? After coming up and summing up all the monetary requirements for manpower, for equipments, interventions, you come up with the final monetary requirements. Post that, you come up with a timeline. That's very important aspect of any proposal. What things you are going to achieve week by week, month by month. Finally, at the end of a year, what you are going to achieve. At the end of the whole duration of your projects, like say 18 months, 24 months, 36 months, what all you are going to achieve. And the proposal also will mention what kind of reporting structure will be there, how frequently you will be reporting your achievements, so that you are not found out of track at the end of 3 years. At the end of 3 years, you don't come up, I was not able to do this. So every quarter you are giving insight whether you are on right track or not, so that the funding agency along with the consultant come and give you advice what needs to be done. So this is precisely about proposal. As I said, it talks about most precisely the requirements and the timelines and the reporting structure, along with 3 things. You go in detail of all the 3. What kind of requirements will be there, what number of manpower will be required, what equipments and intervention will be required, how much money will be required. In timelines, we will be providing from week, from months, quarters, and then years, how you will be reporting your achievements. And then your timeline also comes up with the stipulation of reporting structure. So with this all three, you come up with a crisp and precise proposal. Seeing the proposal, agency thinks, come up with their own suggestion, and finally a proposal is accepted, a blueprint is created, and money is dispersed, program starts. Thank you all. Thanks for listening.